Right. Hello, everyone. I am Ebony Vaughn, and I'm so excited to be here with my colleagues discussing mental health, the stigma of diagnosis and treatment. Again, I'm Ebony Vaughn, and I am coming to you by way of Vaughn Therapeutic Systems. And I want to introduce you to my colleagues and guests. We can start with Mrs. Bridgette.
Good evening, everyone. So I'm Bridgette Thompson, and I'm from Starting Point Therapeutic Counseling. I am a clinical therapist and a social worker. And at Starting Point, our mission is that we're helping people suffering from loss in any way to find hope and strength to start over again. And when Ebony asked me to come on and to be her guest to talk about mental health and stigma, generally, most of my clients come from a faith based perspective. And at Starting Point, we help them to understand that we as people, we are a three-part being. We are a spiritual person. We live in a body and we possess our soul. So your soul is your mind and your will and your emotions. And sometimes your soul, your mind can be sick, just like your physical body can be sick. So we equate mental illness just like we equate physical illness, heart disease, diabetes, high blood pressure. It can be treated. So mental health can truly be treated just like those physical things can be treated. So I'm excited to join the rest of our colleagues and hopefully we can bring some insight and some normal thinking when it comes to mental health because I just think it's the words that we choose. We don't go around telling people that they're crazy. I really just think it's the words that we choose that we can help people normalize mental illness, that they don't walk around having low self esteem because they don't want to be attached to what people say a label. I don't want a label attached to me. So I just hope that this evening we can be a blessing to those who are hearing and help them understand that what they're going through, they're not the only one.
We can just flow. Whoever's next.
My name is Kenya Mcgriff. I am a student at Walden University. I am completing my last semester of internship, and I will be graduating in February with my master's in clinical mental health, specializing in trauma and crisis. Mental health is a topic that I am very, very, very passionate about, specifically with our community. I think it is something that is not discussed enough. There's not enough education about, and not enough resources to really educate our people specifically about mental health and kind of normalizing it. So I think this conversation is very important, and I am happy to be a part of it.
Mm-hmm. And I am Tiara Diggs. I am a licensed clinical social worker with Keys of Hope Consultants. Myself and my business partner have been in business for a few years now, and we do a lot of consultation and training and development for organizations, schools, churches, and anyone who's willing to just kind of change the culture, even some family cultures, when it relates to just normalizing mental health and wellness. And so many of my passions are truly just about changing the narrative, especially in the African American community, of how we address mental health and wellness, and also understanding the difference between mental health and the difference between mental illness, because sometimes we do put those two words together. And so making sure that, people are just educated, and not just having knowledge, but also being able to apply this knowledge, because we can have a lot of knowledge, but sometimes it gets confusing of like, what do you do with it? So I'm definitely excited to be a part of this discussion as well. And I'm also a Walden University student as well. I'm actually working on my doctorate degree. And so in a few years or so, I'll be Dr. Diggs, Lord's willing.
You better go ahead, Dr.
Congratulations.
Thank you. Thank you. Thank
Yes,
you. And
so
congratulations to you, young lady,
Thank
with the
you.
master's. You're welcome.
so you know Tiara just said something, and I just feel like I just want to dive right in. And so you said something that I think is so powerful and something that all of us can talk about and really explore for those who are watching. You said there's a difference between mental health and mental illness. Please,
Mhm.
please elaborate. And if anyone has anything else to add, just go on and flow.
So, for me, and working with, I've had the opportunity to work with all walks of life, from the youngest of the youngest until, older adults. And over the years, I've come to learn that oftentimes, again, people will push those two words together: mental health and then also mental illness. And when it comes to us thinking just about mental illness, of course, we kind of block that away, right? We push it away, because again, from our families generationally, how we've addressed mental health. It's like, oh, that person is crazy, so I don't want to be associated with being crazy. But then also, now that we've become a little bit more advanced in, like, with the computer and digital, we're fed so much information. And a lot of times when, again, they talk about mental health, they show, some of the other sides of mental health, or mental illness. And I just think it's very important for people to understand that mental health is just all about things that we do on a daily basis to
Mhm.
maintain our mind, to maintain our spirit, to maintain our soul, to maintain our physical health. Just the same as we take care of our hearts and we take care of our limbs, we also have to take care of our brain, and again, the soul, and our spirits. And then once people begin to kind of understand that they're just daily practices that you do, this is how you maintain mental health. And then it also supports if you do have some challenges when it comes to diagnoses or things like that. But I think oftentimes, in many communities, not just the African American communities, but many communities, we just kind of put those two words together. And again, I certainly don't want to be associated with something that looks so scary. So I'm not going to take care of my mental health. I'm going to be like, oh, that's not me. When, I may be dealing with anxiety, I may be dealing with depression, but again, because it doesn't look like how it's presented on TV or how I may have seen it in my family, I kind of push it away or push even help away.
And that's
Hmm.
good. When I think of, or how I define mental health, I say, is the foundation for your thinking, is the foundation for your communicating, it's the
Mm-hmm.
foundation for your learning, your resilience, and your self-esteem.
Mm.
And like you said, mental illness is, is a sickness of your mind. It's a diagnosed thing, but it's totally different than mental health. So I'm so glad that you brought that to our attention, because it's important that people know that there is a difference.
Mm-hmm.
And I think also as well, it goes to show how there isn't enough education about mental health and mental illness
Hmm.
and the differences between the two. I know that I'm seeing a lot on social media, people using diagnosis to characterize regular everyday mental health issues.
Mm-hmm.
Such as someone, may tell a couple of lies. Oh, that person is narcissistic,
Oh,
or
their mind.
or
Mm-hmm.
I'm not feeling myself. Oh, I think I might have major depressive disorder. It's not enough information about the differences between mental health and mental illness. So,
That's
And
good.
I also think that what you guys are sharing is so important, because think about that average person. Think
Mm-hmm.
about that person who is experiencing some form of dis-ease because
mhm,
of a circumstance or a situation that they're involved in. It doesn't necessarily mean that they have a diagnosis, like
Mm-hmm.
you guys are saying. It just means that they're having difficulty adjusting to whatever they're, going through. And I want to
Mm-hmm.
talk a little bit about that and why the need for a diagnosis a little later when it comes to insurances and things like that.
Mm-hmm.
But I think that identifying that all of you is important, because people need to know that it's okay to feel sad. it doesn't mean that you're clinically depressed,
Right.
because you're
Yes.
sad. You know, you might have struggles with dealing with hearing, and I'm speaking specifically from a spiritual aspect, because if you don't include faith in that, right? If you don't include, for those of us who are believers, we know that we have the ability to talk to God,
Yes.
and God has the ability to talk to us. It doesn't mean we're schizophrenic. You know what I mean?
Yeah.
I mean, hearing those, sometimes hearing those very painful thoughts and alternatives in our mind. Like you want to snap somebody's neck, or you want to hit somebody in the throat because they done said something inappropriate. And it's not you being, violent, or you being a harm to someone else or danger to someone else, but it's the reality of your feelings, and being able to process that is important without feeling like there is this mental crisis.
And that's good, Ebony, because I remind people that God created us to have these emotions and these feelings.
Yeah.
And it's just recognizing them, call it what it is, deal with it, and then move on. It's just not getting stuck there, not getting stuck in feeling sad or angry or whatever feeling or emotion that you're having. We were created to have them. So it's all right to have them. Call it what it is, deal with it, and then move on. It's getting stuck there. That's where, and I tried, because, you have people say, oh, well, I've read on Google and I have this, that, and the other, and I think I'm clinically depressed. And I said, well, did you really read? It's for a certain period of time. It's every single day, Are you experiencing those things? Are you having trouble sleeping? And are you isolating yourself for this period of time? So it is so important that people recognize that it's all right to be sad and to feel whatever it is you're feeling. And that doesn't necessarily mean that you are depressed, or, okay, we get excited. That doesn't mean you have anxiety. Everybody, has this I have generalized anxiety. All right, well, we all may be feeling a little nervous or get a little excited, but that doesn't mean you have anxiety. So it's important that, I think the internet is wonderful. It's a great thing, but people go on there and Google and just all kinds of things and want to diagnose themselves. Self-diagnose themselves, and that's not always good. It's not always good.
And I think that's where, like, emotional intelligence, the importance of emotional intelligence comes in, self-awareness, and just knowing who you are in your body, knowing what seems normal, what isn't normal. And again, just even having the schools of building up your toolbox so that you can navigate through those challenges of, okay, is this just situational? Is it seasonal? As we say in the faith community, if this is a season that I'm just going through, or again, if it is something that's a little bit more heavy or deeper, then again, you just know how to kind of navigate. But again, just really even teaching people those basic skills of, am I an emotional intelligent being? Do I know myself? That's why self-care, which is now like the big buzzword, and again, people understanding that it's more than just sipping on a green smoothie and going to get your nails done and getting a massage. Those are things and activities you can indulge in, but true self-care is all about, being a good, what is the word I want to say? Being like a good steward over your body. God gives us these bodies. Our body is like our temple. And so are we being good stewards? Are we doing things? Are we practicing strategies, again, that help us to navigate when we have these challenges? And again, then being able to say, okay, I managed it, I'm over it, or this won't go away. Now I need to seek some other help and services. So it's important.
Yeah, that's good. And that's one of the things that I focus a lot about when I work with people, understanding that, yes, self-care has become this tremendous, just cliche. And, when we think about it, we are three-part beings. And so if we are mind, body, and spirit, the deal is, how are you nurturing each of those areas? That is really about self-care.
Mhm.
Self-care is about boundaries. It's about recognizing your capacity. It's about being able to say no. It's about yielding to your spiritual life, right? And yielding to your faith as a source of strength, as opposed to getting your nails done and getting your
Mm-hmm.
hair done. And I always say that that's not my source. That's
Mhm.
not your source. You can get your nails done and you could be sitting in that chair going,
Mm-hmm.
just like really going like, mind racing a
Racing.
mile a minute, and you
Yep.
could be getting your hair done and anticipating what's going to happen tomorrow and what's,
Mm-hmm.
so those are vehicles, but it's not the source. And so it's important for us to understand that self-care has everything to do with spiritual connection,
Mm-hmm.
and seeing it as such. So that's really good. The
That's
other
good,
thing,
Ebony.
uh-huh,
Just to piggyback on what you said about self-care and the spirit, I read something and it really touched me. It says an empty lantern provides no light.
Mhm.
Self-care is the fuel that allows your light to shine brightly.
Mm-hmm.
yes,
Mm.
it's
If
the
our spirit is
fuel.
empty, and we can't provide light to anybody, not even to ourselves, to guide ourselves. But when we use that self-care and spend time with God and refuel ourselves, it allows our light to shine even brighter.
And so I said, and I always keep this in mind. I made the point of saying that our connection, spiritually, is really the source of what we do. But what about that person who doesn't believe that? What could their source be?
Hmm. Hmm.
You have some people whose source is nature. They go
Okay.
out into nature to meditate and really become one with the environment, and that helps ground them.
Mm-hmm.
So that could
Okay.
be one source.
Okay.
Some people, their
Yeah.
source is similar to that. They use yoga, they
Hmm.
use meditation, they spend time, like you said, spend time out in nature, go for walks. And to me, that's even spiritual, because when you're out and walked, you're recognizing the
Mm-hmm.
creation that God created.
Yeah.
So in so many ways, that does back into God. However, they may not see it or call it that.
Yeah.
Um, they'll use those types of that scenery, that serene feel they feel by water, or watching the sunset, or
Mm-hmm.
listening to rain, and things of those things. I'm starting to hear more people saying that they're tapping into that.
Mm-hmm.
Yeah.
And even just rest. The Bible talks
Oh,
about in
that's
Psalms
good.
23, 2 through 3, He makes me lie down in green pasture. He leads me beside still waters. He restores my soul. So even just tapping into rest, and not beating up on ourselves about it. Because again, especially people who are worker bees or just very ambitious. Even when we're sitting still, sometimes I can be transparent. I'm like going crazy because I'm like, oh, I could be doing XYZ. I could be
Mm-hmm.
taking care of this or something. And really, just allowing ourselves to rest is one way to just kind of tap into, another type of a source. And connecting with whatever it is, whatever you need to connect into while you are resting, but giving yourself the opportunity to do so.
Yeah, good, good. All good things. And I always say that because I speak to so many people, and I know that you guys do as well. And some people, the minute you say God, it's a disconnect. Or the minute
Mm-hmm.
you say anything spiritually, they're looking at you like, okay, what you talking church stuff, right? But I really have a fundamental belief that spiritual, freedom is spiritual, like I don't I don't know how to separate that, but I do understand that different people have different vehicles, different people have different sources. And so I love what you guys said about nature and rest and all of those things, because those are things that are important, and they do bring kind of like that revitalizing or refreshing. And to some people that may be important. But I also believe that when we're talking about mental health, it is a journey, right? And I do believe that in any journey, it will always be spiritual. Because it has to be something other than you,
greater than you,
greater than you,
yeah,
that can help get you to where you want to be. And I think I want to jump right into something that I want to say Kenya talked about briefly, diagnosis, right? I want to jump into diagnosis. And Bridgette, you talked about this too. Let's talk about diagnosis. What is it? And how do I know if I'm clinically depressed, or if I'm schizophrenic, or if I'm bipolar? What is that about?
Truly, I say people need not self-diagnose. Like you don't want to go to the hospital and tell them you have this certain kind of cancer, right? So don't go to a therapist or look for a therapist after you have done all this Google search and you know what you got and what you got going on. Because sometimes it's really not that. I think it takes true assessment. It takes truly having conversation with your clients and digging a little deeper and having some more background and things like that, because we as therapists, we use a tool that was given to us, and that tool, when we see what the various symptoms that our clients tell us or present with, then we use the tool that we were given, that we were told that we are to use in order to make a clinical diagnosis, of our client. So I think it's important that people recognize that it's not pie in the sky. We're not putting these things together ourselves. There is a diagnosis tool that as therapists, as clinicians, that we are to use in order to make a determination of a diagnosis. And some of the diagnoses, over the years, the DSM-4 to 5 to TR to 5, they've made some slight changes in them and have changed names around. But it's a tool that we have as clinicians that we should be using to make a determination if someone does have clinical depression, or does someone have adjustment disorder with anxiety, or adjustment disorder with depression, or if they are schizophrenic, or if they are bipolar with depression. It's a tool that we use based on the assessment that we do with our clients to determine what the diagnosis is, and hence what treatment should look like and how long treatment should be.
I think to piggy off of that, being able to normalize, like how we said earlier, mental health versus mental illness. Not every moody person is bipolar. It's okay to be moody. People get moody sometimes. It's okay to be, not feeling like yourself and sad more often than you usually are. It doesn't mean that you have clinical depression. So I think just having those conversations and continuing that education about mental health versus mental illness will, I guess, maybe in theory, help appease people, to calm down a little bit with self-diagnosing, but you just have to keep having those conversations.
And then just truly understanding, again, sometimes there are root causes, to what we think is happening with us. And again, I can't tell you how many times, working with both children and adults, as you begin to collaborate with, the person that you're working with about their history or what's going on. Again, sometimes what may look like we said, depression or anxiety, of those type of things, there are also sometimes some underlying factors, and so again, that's where like a lot of that skill building around self-awareness, just understanding yourself, understanding the connections of your environment, understanding the connections to, your family, your, all of these different things can also create things that look like certain things that we might find in the DSM. And so again, as you both have shared very eloquently, again, it's all about education. It's all about us having these discussions. And it's all about people just really understanding what's going on with your body. And again, sometimes, yeah, it does lead to a diagnosis. And even with a diagnosis, I always say the diagnosis is just kind of like a vehicle to understanding yourself a little better. But at the same time, we also just want to look at the symptoms, because again, I think one of you stated, like, when you go to the doctor, you don't say, you know what, doc, I know for a fact that I have XYZ. They always ask you, well, tell me what's been going on for your body. Well, my nose has been running. I have a red eye. My toe has been on fire for 2 weeks. So they want to know the symptoms, and they don't necessarily give you a diagnosis even with the symptoms. They treat the symptoms. And so even with mental health, oftentimes if you say, I've been sad for 6 weeks, I just can't stop crying. Again, it doesn't necessarily mean depression. We're going to, as therapists, we're going to treat the symptoms. We're going to give them strategies and tools to treat the symptom, regardless of what the title could be. Because it could look like 5 different things at the same time. And we're not going to treat bipolar, schizophrenia, anxiety. Like, we just don't do it that way. We treat the symptoms. So, again, it's just people just being more educated about their bodies, understanding themselves, and then kind of just working with someone to devise a plan that works for them, specifically for them.
And that's good. And some of the things that I heard, and I wanted to kind of highlight about a diagnosis. So when you go to a therapist, when if you are experiencing some kind of mental health challenge or crisis or whatever, some of the things that the therapist will be looking for is frequency, duration. Are there any predisposing factors as it relates to trauma? Did something happen prior to you feeling the way you felt? What are the environmental factors? What kind of household do you have? Is it loud? Is it quiet? Did you have a recent breakup? Were you involved in a recent serious conflict? Did you lose your job? So a lot of things are factored in to a diagnosis. The season that you're in, what's going on with your family, what's going on the job, what's going on in your business. Like, all of these things will factor into whether or not I give you a diagnosis or not. And one of the things that I tell those that I work with all the time is, listen, if you're looking for a quick diagnosis, you might be looking for the wrong person. I might not be for you, because I'm not quick with, you got this, you got that, because there are so many extenuating factors. The other thing that I thought about was medical rule out. A lot of times people may be experiencing a heightened sense of anxiety, and it could be related to a medical issue. There is a great deal of medical conditions that we face every day that have a feature or a symptom of depression, a symptom of anxiety. When you think about high blood pressure, when you think about diabetes, there are lupus, there are definitely medical conditions that exacerbate depression and anxiety. And so, I always say to people who are increasing in panic attacks, please go to your doctor first. Right? Go to your doctor first, because you have to rule out all of these things. Another thing that therapists rule out is, what are things that you are afraid of? Because here's the deal. Fear is real. You will have headaches. You will have stomach problems. Okay. Fear takes on somatic symptoms. Mental health instability has a way of manifesting itself in medical conditions. So that's why it's important for you to rule out those medical things. And I say that so adamantly because around 2020, probably the beginning of 2020, going through the pandemic, so it would be pre-pandemic and post-pandemic, I started working with a lot of individuals who was experiencing significant medical symptoms, and their doctors could not figure out where it was coming from. Okay, so they were having a lot of gastrointestinal issues. They were having a lot of migraines, and they were doing MRIs and CAT scans and all of these things, trying to figure out why these symptoms were appearing. And it got to the point where the doctors was like, we can't find anything. I'm going to refer you to a therapist because I think you need a therapist. And so why am I saying that? I'm saying that because that's real. Like, doctors rule out medical conditions and they turn it into psychosomatic condition. Now, for those of you who are watching, you might have even heard that. You may have even gotten that diagnosis with a doctor. And it's like, you're just worrying. It's just so, but the problem with that too is it could be that, or it could be something greater.
And even And I was going to say, even just when we talk about ruling out these things, when we think about, and I know for social workers, we also learn about ruling out the Maslow's hierarchy of needs. So all of those needs. So psychological falls on there, but there's also safety needs. There's love and belonging needs. There's esteem needs and self-actualization needs. And so again, we have to look at those things first before we even jump to, whether you have depression, because again, if there's a gap in one area, typically there's a gap in other areas. And so again, as we begin to, talk to people, that's why it's so important, again, sometimes people have this notion of what therapy is, and they think they're just going to come in and we're going to, just give them, as you said, Ebony, this, this label. And oftentimes it's us really collaborating with our clients. Good therapists will collaborate with the clients and just really talk about like what's going on. Tell me about all parts of your life. Because again, if I'm worried about my lights being turned off or me not being able to support my family, well, of course, that is going to look like anxiety. That is going to probably cause some feelings of depression. Or if love and belonging, if I'm just feeling disconnected from my colleagues, I'm feeling disconnected from my family, my husband, my wife, whatever it may be. Again, it doesn't mean that I'm depressed, but it is causing some challenges of sadness, And so again, if we don't ask these questions, or we're so quick to label people, and I think that's what happens too. Sometimes as clinicians, we contribute to some of the reasons why people don't want to come see us and don't want to talk about it and don't want to talk about it in their circles, because sometimes we are very quick to label people. And again, if I can't connect to that, or I'm afraid, or even if my experience sometimes with these labels, if I saw my mother be labeled like this, I don't want to be like that. If I saw, my grandmother get this label, I don't want to be that. So I'm not going to talk about it. So I think even as clinicians, we have to be mindful and careful of what we stamp on something, opposed to really just digging a little deeper and helping people to say, okay, maybe I need to focus on this area of my life, see if I, do some things to make some changes first. And then maybe we can go up the next, flight of steps when it comes to if it's a true diagnosis or not.
And that's so good that you say that, because I'm very careful that I do not give my clients a diagnosis. We talk, and I always tell my clients that this is not about me throwing a label at you and telling you what to do. This is a journey, like Ebony said. And I tell them, I'm willing to go on this journey with you. It's going to be about us coming together, us together making some goals for you. What's your purpose for coming here? What? Tell me. You know,
Yeah.
what you're coming here for? What is it that you want to get out of this? What are you looking for? How can I help you on this journey? It's
Mm-hmm.
not about me telling you that you have PTSD. It's not about me telling you you have depression. It's about, like you said, making sure that all of their needs are being met in every area. And
Mm-hmm.
what goals can we set that
Mhm.
you are willing to do the work, because it's work? What goals can we set that you're willing to do the work and make the changes? And I
Mm-hmm.
always tell my clients, please don't start therapy if you're not going to be honest. This has to
Mm-hmm.
Yeah.
be open, honest dialogue. We have to build a therapeutic relationship of trust where the foundation is trust. You know, you can say anything to me. It's going to be non-judgmental, and we're going to go from there. I'm going to be on this journey with you. I'm right here with you. We're going to go through this together. Well,
Yeah.
let's set some goals. What is
Mhm.
it that you want to see changed in the next 6 to 9 months? You know,
Mm-hmm.
let's do this together. So that's good. I had a client who I have been seeing, and it was after the passing of her husband, and I never mentioned a diagnosis, but she decided that after 9 months she really wanted to take some time off. So she asked me to fill out the disability papers so that she can take some time off, and I did. And her question was, we never talked about a diagnosis. And I'm glad you never told me. She said, but now that I understand what adjustment disorder with depressed mood is, that truly is what I'm dealing with. And I said, yeah,
Mm-hmm.
you've been married for 23 years and your whole life has changed in
Yes.
an instant. You know, you have lost your husband, you have lost that other income. You don't even know how to function without
Mm-hmm.
your other partner. So, but I never labeled her, never
Mhm.
even went there with it. And I think that that's so important. And like you said,
Mm-hmm.
as good clinicians, that we're not the problem, that we're not making more of a problem for our clients by giving them these diagnoses and having them have all these, weird thoughts in their mind about themselves.
And even with youth and young adults, as you were talking, I thought about that when I was a practicing clinician. Um, I know billing would hate me because mostly every child I would see, I would give them adjustment disorder. Like I refuse to again put heavy and harsh labels on children and
Mhm.
youth because oftentimes a lot of their distress is connected to the adults in their lives. So how can I put this heavy label on a child when they are connected to people who are sometimes unintentionally causing a lot of their stresses, their opposition, and all of these other things that we can sometimes put on children. And so when you said adjustment, yeah, most of my kids that I've ever seen, many of them would have adjustment because again, it's a period of time they're growing, they're developing. Again, there are other issues or things that are going on that they're sometimes out of their control. And again, we want to be careful even with them because
Mhm.
again, the words are powerful, and especially I always tell my students, I also teach as an adjunct professor. And I say there's power in our pen as clinicians,
Mhm.
and what we write is so important. It travels with
Mhm.
people, and especially when we do it at young, with young children and young people. And again, they begin to internalize that. Their parents begin to internalize that, and they become ADHD. They become oppositional defiant. They
Mhm.
become these things that sometimes it may not be true. Sometimes it is, because there are some children who have those things, but sometimes it's
Absolutely.
not. But we don't give people the chance, young people or older people sometimes, the chance to adjust to life, to figure
Mhm.
things out, to work on some things, give them some tools first before we put these heavy labels. And again, people begin to internalize it. And like we said, now people have so much access to diagnose themselves, then you start acting like some of this stuff, and it may not even be that.
That's good. That's really good, especially with our children. And I believe that's why a lot of parents in our community, in the Black community, um, don't want to go have their children tested and things of that nature, because
Mm-hmm.
you're not going to label my child.
Mhm.
You're not going to. That is the mindset. And you're right. The power is in our pen.
Mm-hmm.
In Even in schools, when we're writing individual education plans and we're putting
Mm-hmm.
all this stuff on our babies, on our children, and the parents are reading it and like, what? And then the children are hearing it and, yep, that's they running around. I got ADHD and I have, I got ADD. And I'm like, no, you don't. Just needs to teach you how to sit down, how to stay focused, sit on their level, talk to them face to face. You yelling stuff at them, they're not hearing you because I doing this. Get on their level. They probably don't have it. They just need you to challenge them a little bit.
Even sometimes we teach, or sometimes I think we sometimes even teach at a young age, and even adults, that it's not okay. I think we talked about it when we first started talking, that it's not okay to even feel angry or feel frustrated. So even when children come to school sometimes, they have a bad day just like we have a bad day. But again, the first thing that comes out their mouth is, did you take your medication? It must be your ADHD. It must be all of these different things. And why can't it just be, I'm just having a bad day. I'm experiencing these emotions and I'm supposed to experience these emotions. And again, how do we even break the stigma around that? Like, it's okay for me to be angry now. What's not okay is for me to go punch a hole in the wall. But again, that's why we learn strategies and we learn tools. But I think even not just with children, we do that. We do it with adults too, and a lot of our workspaces or even spaces that we convene in, we just don't have permission to just be, and so oftentimes we either hold it in or you do see people explode because again, we don't necessarily create these spaces for each other that just like it's okay to be happy and joyful. Well, there are going to be some days where I'm not my best self, but I need to be comfortable to not be my best self and not be judged and criticized or again thrown some label like, oh, she must be bipolar. No, I'm not bipolar. I'm having a bad day. I woke up, I didn't feel good, or I woke up to my tire being flat, whatever it may be, and it doesn't necessarily always connect to some major diagnosis. And it may be. And even if it's that, it's okay. But we have to make these things okay.
Yeah.
Do you have a thought with that, Kenya?
As I was listening, I was thinking about how I've seen on the other end of that, where I've seen therapists that I think overdiagnose. You see it a lot of times. Well, in my experience, I've seen it a lot of times in like the psychiatric setting with a dual diagnosis, all of these things. And I think what's not taken into consideration is that environmental piece. And I really liked how you guys talked about how it should be a collaborative effort between the therapist and the client, because I've had people sit in front of me and say, I spoke to the therapist for 20 minutes and they told me a diagnosis and prescribed me and gave me a prescription. So I think it's very important to have that grace and look at the full picture before diagnosing.
And that's good. So let's talk about the real deal, right? So let's talk about the money piece, right? And so now, for those of you who are not clinicians and you are not part of and I'm going to get to some of these comments in a sec, but I wanted to talk about everything that we talked about, but then we got to talk about the reason why we diagnose, okay? So the real deal is, we don't diagnose, we don't get paid, guys. So every insurance company, okay, they are, when we bill our claims, and this is not just for mental health, but it's also for physical health, any kind of health, okay? And so let's talk about this thing, because here's the deal. In most insurance companies, the first session, which is the initial evaluation, there is a code to that, okay? That code requires a diagnosis, okay? So the insurance companies requires the therapist, the clinician, to give you a label the first time they see you, okay?
So true. You need that ICD-10 code.
Yes. Yes. Say it again.
You need that ICD-10 code if you think you're getting paid for that session. And I learned that I'll say the hard way, because I put uncomplicated grief, because that's what I really felt. And that insurance company said,
I'm not
I'm
paying
not
you.
getting paid for uncomplicated grief. And I'm like, oh, okay. So let's
Yes.
listen to the client just a little more. But I'm still very cautious that I am not giving you all the I think the diagnosis of least harm is you need it's adjustment disorder. You got to adjust to this, you got to adjust to that, and adjust to this. So you either have some kind of generalized adjustment disorder, because we all need to adjust to different things in life. Like one of my colleagues said, you guys said, the different seasons that you're going to. You lost a job, you were sick for months, anything could have happened, and you need to readjust and start and do things a little differently. Maybe you need some more tools in your toolkit, so you need to adjust. So I'm still very careful.
Absolutely.
If I can just say adjustment disorder, and if we continuing to see each other and work through our goals, and if we're seeing a little more and things are coming out and you've gone to the doctor, and then okay, but yes, you're not getting paid unless you're a self-paid client, and most of our clients are not. You're not getting paid, even in couples therapy, right? You have to have a diagnosis if you're billing that insurance company. It's sad. However, it's the way that the world is.
But I think,
and it doesn't. And the thing about it that it's important for us to be honest with is that diagnosis at the initial session is what you see and observe in that session. But that's with the information that you're giving. But a lot of times as you continue in the session, you might identify another diagnosis. But I think that, I've had people, that said to me after the first session, okay, so what's my diagnosis? You know what I mean? And it's like, well, let's talk about that, because the reality is I do have to diagnose you. So a lot of times I say to people, this is what I have identified you with thus far. But as we continue to work through it, we will, talk more. But I wanted us to have that conversation because it's real. So for anybody who's watching us, if you go to a therapist and they have to give you a diagnosis, just keep in mind that might not really be your diagnosis. They just trying to get paid. Okay.
And I think it's important for us to kind of acknowledge, like, again, just the importance of just educating people of how to be their best advocate, even when it comes to therapy. Because again, like, therapy is booming these days. Everyone wants to, dig deep and all of those things. And we have to have a real honest discussion that people are profiting off of people's pain, and because of that, and again, teaching people, now that we're at this place where, again, everyone wants to do therapy or be a coach or whatever you want to call yourself, how do we, again, empower people so that, again, they're not turned away from these experiences of some people who do profit off of pain, and really, as Miss Ebony talked about, just really know how to navigate beyond the first session. So, okay, you have this diagnosis, but are people just pushing medicine your way, or are they really working with you around whatever the diagnosis is? And again, are we giving them strategies? Are they seeing growth? Are they actually helping with the treatment plan, whatever that may be? Are they able to ask questions? Do they feel empowered or drained once they leave their like all of these different things? And I think a lot of times people, you don't know what you don't know. And so a lot of times people are turned away from the therapeutic process because, again, they're like, well, I went to my first session. She told me I have bipolar, 1 disorder. And again, if you look at the commercials, like, they have all of these things that are also feeding your brain. And again, depending upon what happens after that first session, that's when people kind of tiptoe back out, put the church finger up, like, you know what, I'm just going to keep praying or whatever it is that you do, opposed to engaging in the process. So I think even with that, I think now there needs to just be more education around, like, okay, even once you get this diagnosis, because we do have to go there, these are things that should be happening, and this is how you can advocate for yourself, or that therapist might not be the therapist for you, those types of things. But again, just helping people to even just understand that portion of it, like, yes, you may get this label, but it may change, that might not even be it. Or again, as you get to know a person, like, again, it may be other things that are happening in the background that make that label make sense. So I think just more education around that.
So
And that's good that
let
you
me
said that about, that therapist may not be for you, because every therapist is not for every person.
right.
That is so key. And that's why for my practice, my business, I do a 15-minute consultation, because we need to see if we do fit, we may not. And that's okay. Don't be offended if you're a therapist, if you're a clinician and a client decides, no, I don't think so. Or after that first initial assessment, they don't come back. They may not feel that you're for them, and they shouldn't have to settle.
Absolutely.
They should not have to settle on you being their therapist if they don't have that level of comfort. They just may not. And it's okay. It is okay. But everybody isn't for everybody. All of our approaches are not the same. And it's important that clients get to, because I can't build a therapeutic relationship with you if I have my walls up so high and there's just something about you that I'm not sure. You'll never come in and be open and honest with me if you feel like you can't trust me. So it's important that those people who are watching, that they recognize and know that everybody's not for you. And if you do not feel comfortable with that therapist, if you don't feel like you can trust them, then don't feel bad if you decide to go find someone else. Go get a second opinion if you need to. Go somewhere until you feel comfortable. I have a lot of clients that come to me. You're an African American female, you're faith-based, and that's what I've been looking for. Oh my goodness, a sister, I have had Caucasian clients. However, a lot of the African American clients that I have, they're like, I went to a Caucasian therapist and it just did not work for me, because culturally they can't relate. So you have to be able to have a therapist that you can relate to, that you feel comfortable sharing certain experiences, and that you don't have to explain why we are the way we are, and and things about our lives and our families. We don't necessarily have to explain that within our culture, that we may have to explain somewhere else, and that can be a hindrance to why you don't continue to go back.
And so one of the things that, in listening to what you guys said, one of the things that stood out was your diagnosis is not a life sentence. So just because you're diagnosed with something, that can change, right? And it's also something that I hear a lot, because people think that it is generational. So it's like, well, my mom had depression, my mom had anxiety, it runs in my family. Like I hear that a lot, where people say it runs in my family, and it may, there may be a predisposition for it, but that does not mean that has to be your story. And so, because that can be environmental, because some people have grown up with people who've never been happy. And so they have, just kind of learned how to be in that kind of environment. And now they're perpetuating it. So it doesn't necessarily have to mean that they're clinically depressed, but it could mean that they don't know what anything else looks like. And so that's why it's important to really understand that it's not a life sentence. So we have Danielle on saying hello to everyone, and she said that yes, self-care is also is also internal care as well.
Mm-hmm.
She talked about how it's good to put a name on stress and
Mhm.
fear attacking the body. She says that yes, wasting time and money if you're withholding information and not being honest with yourself first, and that's what Bridgette was talking about. Jay Reeves said, if you don't give a diagnosis, does that mean that insurance doesn't pay? Absolutely. Absolutely. If I say, Jay Reeves, if I say I don't know yet, then it's a big fat zero on my check. Okay. And so that's, I want to be very clear with that so
Mhm.
that you know. Um, that, and Jay Reeves says, is it weird that I consider my therapist a friend? I don't know if that goes against any guidelines. Now,
Well,
I'm gonna let y'all talk
Well,
about that.
for me personally, you can call if you choose to call that person your friend, but that person sure shouldn't be looking to you as their friend,
mm-hmm.
because that's having two relationships, and it's
Mhm.
unethical for us to be in a dual relationship with you.
Mhm.
So
Mm-hmm.
I'm very clear. I do not have clients who have been my friend, who your parent has been like a mother to me. Nope. Nope. We are already in a relationship, and I cannot now have a therapeutic relationship with you when we have already had a relationship. I've heard of clients, their siblings talk about, don't you have some single clients that you can hook me? No, oh no,
Oh no.
you can't enter into a dual relationship. And I tell people all the time, my license is my livelihood, and I'm not going to lose my license behind being in a dual relationship with someone. So if you
Mm-hmm.
want to call your therapist your friend, that's on you. But I sure hope that that therapist does not include you in that friend circle, and don't be offended by it,
Yeah.
because that's a dual relationship and they should not be having that.
Yeah.
And I would second everything that was said, but I think also um I think for you, it would just be maybe digging deeper as to why that seems to be that type of connection for you. And I know sometimes, as therapists, we will model certain behaviors. So it sounds like you feel very comfortable with this
Mhm.
person. So again, maybe it's a way for you to model, like, this is what a healthy, somewhat type of relationship just between two people in general looks like. But again, also maybe exploring, why, and it doesn't have to be a right or wrong about this, but exploring why this therapist seems to kind of take on, like, as a friend to you. And again, making sure that that doesn't come in between the therapeutic relationship, because of course, as was said, we as clinicians cannot have those type of relationships, but at the same time, it could be a way to model or teach some skills of, okay, since you're comfortable in this setting, let's practice how you can actually create some other true friendships that maybe resemble something healthy, where you feel like you can talk to a person and they listen to you and they're not biased, like all of those types of things.
I think it's important also, ethics aside, and not obviously having the dual relationships. I've seen where, for example, I had a friend, her therapist, she looked at her therapist like her friend, but it got to the point where she would not tell her therapist certain things that you should be able to share with your therapist, because she didn't want to disappoint her therapist. She didn't want her therapist to be what she perceived as
That's
upset with.
good.
So when
Mm-hmm.
you are having, that's why it's so important to maintain those professional boundaries. And that's not to say just because you look at your therapist as a friend, obviously that your therapist looks at you as a friend, but it's very important to reinforce those boundaries for your client, because for that very reason, so that they're not trying to hide things from you or not bring what they need to bring to the session, because out of fear of disappointing you on a level that they shouldn't feel that way about.
Mm-hmm.
That's really good.
Absolutely. And it's all of those, everything that you guys said is just, it's so true. And I think that some of the things that come up is friends on social media. It comes
Mm-hmm.
up, I want to invite you to this event. I want to invite you to that. And so, I think that this is something where we can say now that technically we're not supposed to do it, right?
Mm-hmm.
Does it happen? Absolutely. But the lines can become blurred, as everyone said. And sometimes when the lines are blurred, you could compromise on, just what you say. And I don't need to say anything else about that. So, Jay Reeves also, let me says, oh, so Danielle says, I just want to say thank you to all of you as therapists. I feel like we give y'all the problem and y'all make it easy and less intense way for us to look at it, and tools to help navigate through the issue. Absolutely. She says that yes, consultations help because some people aren't suitable clients for me to work on their hair, because she is a stylist.
Dallas.
And,
Mm-hmm.
so that's so true,
Mhm.
So Jay Reeves says, I did not like my therapist and I don't think she liked me either. That's, that's y'all talking
It's
some
real.
good stuff here.
Yeah.
That's
Because
real.
That's real.
That's why I
that's-
mean it's important.
so
I do
happens.
consultations because for me, I believe it's important that I remain my best self for my clients and for myself and my family. And if I think that you're coming with a whole lot of stuff, that I have to be honest and say, no, I am not in a place that I can take on a client that this is going to take a whole lot of time. That they're going to be blowing up the work phone and constantly sending emails and having an emergency and crises all the time. So I'm honest with myself, and I have to be honest with that client and say, I am not in a position, to become, your therapist. So that's important. That's, having those boundaries, being professional about it. It's important, so that's all right that you didn't like your therapist and you didn't think your therapist liked you. It's important that you are with someone that you all can flow. That's good.
we getting some good questions here. I'm liking this, and we almost in our hour, but we are at our hour. But so Danielle says it's healthy for a therapist to have a good therapist. Absolutely.
Yes.
And there are times, if not always, where therapists can have therapists. Jay Reed says, why do most therapists suggest journaling? What if I feel that journaling doesn't work for me? Am I broken? Oh, that's good.
Oh, absolutely not. As we've all kind of talked about, again, therapy is a collaborative effort. And honestly, when you come to us, we are not the expert. We just maybe went to school and obtained a little more information, but you are the expert of you. And so we actually let you sit in the, well, we should allow you to sit in the driver's seat. And again, we just use these things that we've been blessed with and also what we've learned, through our schooling and education to help you figure out what works for you. And as you said, journaling isn't for everyone, just like yoga isn't for everyone. And sometimes Zen isn't for everyone. I have some people that I work with who need physical. So, you find them in a gym or you find them doing something where they're punching or whatever the case may be, because sometimes that's what you need. And that's where, when I talked about earlier, that whole self-awareness, you understanding who you are is very helpful in the therapeutic relationship, because then we can use whatever you're sharing, like, this works for me, oh, that doesn't work for me. I tried this, but that really didn't work. And again, we can then help you to navigate a plan of action of, okay, how can you implement these things through all parts of your life? And so, yeah, and that's where it also comes with, again, us really empowering people to advocate, even if you like your therapist may tell you something that you just totally like, no, that's not me, or I don't agree. So you being able to feel comfortable to advocate for yourself and say, no, that's really not for me. But I was watching Oprah and I saw that, somebody mentioned this. Can I try this? And again, if you have a really good relationship with your therapist, again, no one should be telling you no, because at the end of the day, we have to make sure that you feel empowered to make the best choice for
Mhm.
you. But you should be able to come to a space where you can say, I want to try this, or no, this didn't work for me. And you shouldn't feel like you can't, say those things. And if you do feel that way, again, you may want to kind of revisit, is this the therapist for me? And again, it doesn't mean that that therapist is a bad therapist. It just may not be the person that you need or can give you what you need if they're just kind of offering one set of type of strategies. So,
I
So
think that's why it's so important to build that rapport with your clients as well, because as we said before, therapy is a collaborative effort. I know for me, I'm not a journaling person. That's not, I don't find peace from journaling at all. And I know that there's other people who might find peace from journaling. So I think taking an individualistic approach to therapy as well.
mm-hmm,
There might be people who get peace and solidarity from drawing. There might be some people who get that from doing pottery or whatever the case may be. So just looking at every person as an individual and gearing it towards them.
mm-hmm.
So another question that we have is, how do you not judge as a therapist?
Um, for me personally, it's just a way of life, and I always just share with my clients. This is a no judgment. This is a safe zone. Safe zone. Say what you want, and I believe that we're some of us that just it comes naturally.
Mm-hmm.
Then some people I think are trained to help in a non-judgmental way. And
Mm-hmm.
as social workers, as clinicians, we have ethics, and when we choose, we have chosen this profession, we have chosen to go into this field. And in choosing that, we know without what we are. And those are one of the things, that we're ethically, bound by. It's a no judgment zone.
Mm-hmm.
I think for me, again, personally, it's something that has become easy for me. Like, who am I to place my values, my morals, my judgment
Mhm.
on you? So I really do try to live that as a lifestyle, to
Mm-hmm.
have a non-judgmental way about me, and to have, this, that you feel ease and comfortable in talking to me, and
Mm-hmm.
I hear that outside of being a therapist. It's just so easy to talk to you, I appreciate that. And not making faces when clients say stuff and be like, ooh, and
Mhm.
it just becomes a practice of
Mm-hmm.
yours, or has become a practice of mine.
And I'd say for me, I think naturally I've always been that way as a child.
Mhm.
And again, I think for me it's tied to my passion and my purpose. And just being a vessel. And again, a vessel of understanding people. Because again, you want to be able to be who you are and be transparent. And that's the only way. Like I said, I'm very dedicated to people healing themselves, and again, utilizing tools. Even me, I consider myself a tool.
Yes.
um but utilizing the various different tools to heal yourself. But again, people can't do that, or they don't feel liberated to do so if they feel like they're being judged. And so again, as you stated, like, it does take practice for some people. So for some people it comes naturally. And again, for those of us who are clinicians, whether it be the social work route or other routes, many of us are tied to ethics and integrity and all of these different things, where we are supposed to meet people where they are, where we're supposed to allow you to be the onion and allow you to peel every last layer if you need to. And we kind of not necessarily stare at you like you're crazy, but we don't show, not necessarily that we don't show any emotions, but again, we truly are there to kind of listen and absorb, and allow you the space to be who you are so that you can get to where you need to be. And that's just important.
I think for me, not to say exactly what you guys just said, but I think it has always just come naturally to me. Everyone has a story.
Mhm.
Everyone has things that have happened in their life that they've done that they don't feel the best about. Me as well. We're all human beings and we're not immune to the human experience. And that's a part of that. So I always give my clients that validation that, hey, this is really brave of you to sit in front of a person that you don't know and tell all your deepest, darkest secrets. That's very brave. And I think just making sure that we're having those conversations with our clients and giving them that validation that, listen, we get it. Like, there's no judgment here. You're safe here.
So, even as I listen to what everyone says, I agree with everything that everyone says. And I have like a twofold kind of thought behind it, both personal and professional. To start with the professional side, ditto to everything they said. But the other addition to that is I really feel strongly about the clinician choosing the population in which they want to serve. Because the reality is there are some populations that a clinician may not have the capacity to deal with because of their own biases. And it's nothing wrong with that. Yeah. There are some areas where, yes, I am going to judge you because of my past and my experience. And so it's important for me to be self-aware so that I know that, I can say that through, I believe it's through God and through the gifts that I have not come across a population that I have not been able to serve, right? I've worked with sex offenders, I've worked with, murderers, it's something that, from a personal standpoint, because of my life and the things that I endured, both things you may know about and you may never know about. I don't have the foundation to judge a thing or nobody. Because I got some stuff, you look at me and you're like, what? So that's the personal side to me. I don't have a footing to judge anybody, right? And I need God. And so the personal side to me recognizes that, and I'm able to do that. But I also teach, if you know that there's something that you cannot stomach or tolerate, then just stay free from it. I've had students say to me, I would never be able to work with, drug addicts. I will never be able to work with pedophiles. I will never be able to work with children. I would not be able to work with perpetrators of domestic violence. There are taboo populations and issues that therapists have to choose to stay clear of so that they won't impart their bias and their judgment. Do we have judgments? I would lie for Jacqueline, who said, I would lie to you and say, if I said to you that there weren't times where I was sitting in front of my patient and my patient said something and I'm like, why would, now that I didn't show that, I didn't say that, but it's something that I had to process on my own. And so that is part of being a clinician as well. To say and I'm just speaking from me, to say that I've never judged in my clinical sessions, that's a lie, because I have found myself not liking something that my patients have said. And there were times, even recent, I was talking to Kenya about a client a couple of weeks ago, and I was like, this client gets on my nerves. Like, they just do something to me. Like, and I have to catch myself and I have to recognize that that's my stuff. Right. And so to answer your question, when you say, how do you not judge as therapists? I got to recognize my stuff. I bring stuff into a session and I have to be completely honest with myself. I got to watch my facial expressions, because some stuff people say, yeah, it takes me before Luke, or I could be thinking, I agree with him. You know,
Yep.
like, yeah, I would be up there too, blazing, but I have to cut all of that out,
Right.
right? Because that's unprofessional, number one. And number two, in that session, the only person it's about is that client. My focus is on that client and not on me. So I think that everything that we're saying, it has to do with not only are we journeying with other people, but we're also on a journey because we have to deal with those biases that we might have, that interferes with our practice. And so Danielle says that's not good. Why it says why we can't be professional enough that a client don't feel that you don't like them. I don't like some of my clients and they didn't know that. Absolutely. So, just like I said, I feel the same way. My client would have never, because I really like this person. I really do. But it's just some things they say, it just gets under my skin. But I have to deal with my stuff, right?
Yeah.
So Danielle said, I love that we are experts of ourselves. Jacqueline Shaw says, where do you guys go to dump all that you hear? That's good. And I got some other questions to answer. So if somebody want to answer that, and then I'll
So I know for me, prayer is one space. Spirituality is very important to me. So prayer is one space. I definitely have a really good like social support network. So I have like a lot of really strong clinician friends who I connect with, and I can kind of talk to about these things. And again, I'm very strict about self-care, true self-care. And so again, I'm always just mindful of making sure that I release any and all of these things because again, it does where we are absorbers. We absorb all of this, even if we try to compartmentalize what we think we keeping out and not keeping out. I also just kind of make sure again that I'm mindful of again what I take in as well. So outside of like talking to people about their concerns or issues or challenges, am I also feeding it with again social media, the news, those other things? So again, just being very strict around my own boundaries about making sure I'm releasing these things. I'm practicing again, talking to people, connecting with people, prayer life, and engaging in other activities. I love music. I do like to write sometime. It just depends, but just making sure that I'm doing all of those things to just kind of get that stuff out of me and that it doesn't sit on my shoulders. And even now, like I said, I don't practice as a clinician, but I even have cutoff times as to when I'm like absorbing stuff or talking to people. So, if I'm supposed to end the work or something at a certain time, or even answering emails if people have questions or DM people, always do sometimes reach out and say, hey, I have a mental health question, or can you tell me about something? Even just placing those boundaries around those things, because again, sometimes you can get sucked into these things. And if you don't have a cutoff or a limit, you will always be, helping and supporting people, which is nothing wrong with that. But again, it does wear on us. So it's kind of a bunch of different things that I kind of use to dump all of this stuff so that I can stay healthy and strong.
So I want to keep that. I want to shorten that because I want to read something that was just wrote, and I think I want you to talk about this. So it says, so long live Manny Mitchell says, I'm glad to hear this because my therapist seems to bring her problems in during our session. She cries and all. I was confused.
Oh
I would
wow,
be
that sounds
confused
like
too.
some
I would be
that sounds like
confused.
some transference going on.
What did
That's
you
what
say, Bridgette?
it sounds like some transference going on.
What's can you define transference?
Where the therapist is in the place that whatever their client is dealing with, they're hearing it and taking it in, and they're relating it to their own life, and they are transferring their feelings and their emotions, onto that client. that should never. And if you're a clinician, a therapist, and you are not in a good emotional space, please cancel your clients for that day. You have got to be in a good place emotionally, spiritually, before you take on other people's stuff. If you sitting in sessions crying, based on what your clients are saying, you have to be confused. Am I the therapist or you? Why are you crying? Because I'm sharing with you as your client. That is so unhealthy, and it goes back to what Ebony, you said, knowing your stuff, identifying your stuff. And if you need to take the day off, some time off, where to regroup and to rejuvenate and to get yourself together before you go and have sessions with clients, and that's what you need to do. Take some time off. Like, how do you dump? I do not compromise my days off. My days off are my days off. And I'm not going to compromise my days off. I'm not going to compromise how late I'm seeing clients. My last time is my last time. So it just goes back to, how do I dump? I have my boundaries. Prayer is important. Mindless TV, just stuff that don't mean nothing. You're just watching it and laughing. It means nothing. And I shared with one of my sisters, my new thing lately is I've been coloring. And I find so much peace in just coloring. But it just, if you have a therapist and he or she is sitting there crying with you, that is not a good sign. And that therapist needs a therapist, not their client to become their therapist, to having, themselves crying and transferring what they're dealing with onto their clients. It's just not good.
And also something I think we got to recognize too, we talk a lot about trauma bonding when it comes to people in relationships. Well, let's have a conversation about clinicians who trauma bond, under the guise of building rapport and building relationships with clients. And so again, as we've all talked about, that whole self-awareness around, are you addicted to trauma? Are you addicted to people's pain? And that's a real thing. I think sometimes clinicians don't kind of acknowledge. And so again, that's where you will kind of sometimes find where that transference or the disconnect around boundaries happen, because you yourself are connected to this trauma in general, like people trauma drive you. And again, that is an issue that of course needs to be explored. But then, like I said, on the same time, on the other side, again, clients also have to be aware that that's not appropriate. And again, you are empowered that you don't have to stay in that situation. I don't care if you're court mandated, you have to advocate for yourself and say, hey, I'm coming for help, but they asking me for help, and this is not supposed to happen. I'll say, I don't know anything else about therapy, but I know this isn't right. But again, clients, whoever's watching, feeling you have the power in that situation as well to say, hey, this is making me feel uncomfortable. You may not say it as my therapist that we need to sever ties, but I'm going to, self-advocate and sever ties because I need someone who's prepared to help me. And again, therapists and clinicians, we're all human. As Ebony talked about, we come with our own stuff. Disfortunately, many of us are doing things to make sure that they don't show up in sessions. But and I don't want to disgrace a person who is going through something. But at the same time, as a client, you do have the power to say, no, this isn't for me, this isn't working, and also self-advocate so that you don't continue in that relationship and you find someone who can truly help you.
This is good. We are almost
I see the expression on your face, Ebony.
Yes, I'm good. Listen, we are going into an hour and a half, and I believe this is some good stuff and there's some helpful stuff. I want to read what she says. I think Kenya, were you about to say something?
I was just going to say, I think that's why it's so important for us as clinicians to have outlets, to have a sense of community, to be able to talk about these times when, as you said, we're all humans. We're not immune to having a bad day or being not in a good season in our life. And sometimes we can take that stuff into our sessions with our clients and trauma bond or connect in a way that's inappropriate. So having someone, a good supervisor like I have, Miss Ebony Vaughn, having a good supervisor that you can talk to, having good social supports that you can talk to about how you're feeling, so that, some of that burnout and vicarious trauma doesn't impact your relationship with your client.
And also colleagues, because like the example that I gave, that time I got off the session and I was talking to, Kenya, I was like, she get under my skin. So sometimes processing that, and I don't know, Kenya said something clinical, like, do you think she has so-and-so? And I was like, yeah, she get on my nerves stuff. but that's the part to, just like doctors, just like lawyers, hairstylists, all of us as professionals, it's good when you have, like Kenya said, that sense of community. Samara, that's who it is. She says she makes me sad. I'm already messed up, So the encouragement here is find somebody new. Now, what I do want is the other realistic side to that is, as a clinician that supervises clinicians, there are many cases where clinicians does experience, as Tiara said, an emotional reaction to something like death, or maybe it's something very it's just something that's like, oh my God, my heart, and they experience that, and maybe they do shed a tear. Whenever the therapist becomes a distraction to you processing your stuff, that's when it's a problem. I'm not going to say that shedding a tear because of the loss or the sadness of a child, a young child, that, so it's not a blanket statement, but if every time you come into the session and they're just crying and all into you, all into the details of your trauma, then that's when I want you to start thinking about, and it sounds like in this case, this is an ongoing thing. So if it's an ongoing thing, that therapist is a distraction. And so you have to remove yourself because they are a distraction. But I don't want you to think that if a therapist sheds a tear, they're not a good therapist, but it's just about how that follows up. Because some people are still learning and growing in their process. And there have been some times when that tear could have caused a connection, right? But if they continue in it, then it becomes them that is the client and not you. So I want you to think about the cycles and the patterns and how often that happens, because it's, there's some devastating information that you can get. And, I can't promise you that I'm not going to swallow, or brace myself for whatever it is, but it's only to prepare me to be better for you. Right. And so that's the other thing, right? So she says, not saying that she's not good. She just seems to always be sad and want to talk about my kid. And so that's what I want to share. And that's one of the things that I teach too. Don't get so caught up in the details. Like sometimes we get so intrigued, like, tell me what happened next. And, we want all of these specific details about trauma. And you have to be careful that you are not re-traumatizing a person. And so, like she says, she always wants to talk about my kid. And this, what Samara has just experienced is death of her child, her young child. And so she's in counseling because of that. And so, like she says, it's, I don't want to talk about my kid. And she just brings it up. And that's a problem. All of these issues are things that is leading you to understand that you have to get another therapist. Because if I am keeping you in your trauma, then I'm not helping you to, to journey through it. And so that's important. All of that is important. But A therapist being empathetic and connecting with your pain, if they're doing it all the time, then that's not good. But if it's an immediate reaction, then that's something that if they have the right support and supervision, they're able to bounce back from. Because
Right.
I have worked with people and worked them through that. And, they felt embarrassed because they did it. And, and I help them to understand that it's normal, but we got to take care of our own selves away from those that we're working with. So Samara said that she called her supervisor and they're going to change it. One of the other things that I wanted to ask you guys is, it says, how do I know how to choose a therapist? And does it matter whether they are male or female?
Oh, go ahead.
I was going to say, for some people, it does matter. Some women want to work with women. Some men want to work with men. Some African Americans want to work with African Americans. So again, it's an individualized thing. It's a choice that you make as a person. What works best for you? Because we all have, as we've been saying this evening, we all operate our practices, our businesses differently. We all don't present or do the same thing. So it does make a difference, and what works for you. If you can't find a therapist that you feel comfortable with, that you feel that you can build a therapeutic relationship where you don't feel judged and you feel comfortable opening up and talking to them, or they're putting their emotional bombs on you and attaching to your trauma, then maybe that person isn't for you. But it's what works best for you. And it's for you as the client to make that choice. And what I say to my clients, don't stop at the first person. If you're not settled in this, and I tell them, I don't take it personally, but don't stop. If you don't think that I am the person for you, I want to be on this journey with you. If you don't think that I'm the best person to be on this journey with you, then don't stop. You keep going until you find the person that is best for you, who you feel comfortable. Some women are coming with certain things and they don't want a male therapist. They want to be able to have open dialogue about certain things, and vice versa. So it does make a difference, and it's what works for you as the client. Like my colleague said, you are the professional in your own life. You know you best, so you know who and what works for you.
And so one thing that so Danielle says, so it's more of a comfort level that would allow me to be most transparent, and that's real. That's it.
Yeah.
And then, Samara says, it don't matter to me. I look for support because my heart is broken. And that's real.
Yeah.
She experienced the loss of a child. And so she needs help learning how to live. How do I live my life without my child? And so having that support and being in counseling is so important. My last question, ladies, and this is like, I'm so excited. This is so good, guys. So, how do I know when therapy is over? Like, how do I know? Am I ever finished? Or is there such a thing?
Of course, there can be. If you have created treatment goals, which we all have talked about, if you have come together with your clinician, you guys created treatment goals, and those goals were met, then sure, therapy can come to an end. It's definitely possible, but again, this is a journey. So if on your journey you have reached those milestones that you and your clinician created, then of course it can end. It definitely can. But if those milestones weren't reached, if those goals were not accomplished, if you didn't do the work that you needed to do, to accomplish those goals, or you find that you're, your symptoms are still there, and or maybe depends on what you're there for in therapy for. Maybe you relapsed, so maybe you may need to take a few steps back to take a few steps forward. So yes, it is very possible that you can reach your treatment goals and no longer, I wouldn't say no longer, but at this present time that you're well enough to go on. And I've seen clients who have gone without a therapist for many years and then find that they need to come back, in therapy again, because some of those things may have happened again or resurfaced, or someone triggered something, right? Something was triggered and it reminded you of something that happened in the past, and you find that you need to go back. But yes, you definitely can get to a point where you no longer need therapy if you have met those goals that you established in the very beginning.
And here's the thing with, I'm sorry, go ahead.
Oh, no, go ahead.
Here's the thing with that as well, is that life never stops happening. So although you may reach your therapeutic goals in this season of your life, you might need to come back and get some maintenance and get some new tools to deal with new conflicts and new situations that arise in your life. So you can be done for this time period and feel like you need it again for this time period. It's just completely up to you and what you feel you need.
And I agree. And I was going to mention maintenance, almost like, we maintenance our car. And sometimes we not necessarily taking our car to the shop just because it's like, running on fumes. Sometimes it's just preventative work. And so I think what we also have to talk about with therapy is that it doesn't always have to be doom and gloom that you're going back for maintenance. As was stated, you may reach your goals, but sometimes we also have to think about what are our happiness triggers. We talk about our challenges that trigger us, or things that trigger us, for the doom and gloom. But sometimes you may engage in therapy. How do I keep this ball rolling? 6 months later, I've been doing okay, but I want to be preventative. And I think that brings us full circle to the difference between mental health and mental illness, and how do we just maintain overall mental health. And a part of that is just being preventative. Okay, you're in a space where you feel stable, you feel great. So how do we maintain that? And sometimes it is doing a check-in with your therapist to say, hey, life is great now. How do I keep this going? How do I fill my toolbox up? How do I maintain strategies? And again, it doesn't have to be anything wrong for you to still just have that connection with someone who can keep the happiness train going, or the positive train going for you. So it could be a continuum, and it could be on a positive preventative level as well.
This is all good. Danielle says, I think a therapist can help, but it's up to us to make the change, and we may need it later down the line. Samara said she appreciates the advice she was given. Danielle also says, I feel like that with a marriage, we need maintenance and mediation. And that's real, cool. And man, y'all just bringing these questions. I mean, y'all just saying these things and it's sparking all this stuff, but I'm not going to do that. But here's, what I do want to do, because I think these are so much buzzwords. And then after we say this last thing, I want you guys to share about your practices and how we can reach you. Tiara is, she'll tell you what she does and how you can reach her, and Bridgette as well. Now, what I want to talk about is this whole idea of what's the difference between a coach and a therapist, okay? Because coaching is the buzzword now, right? And so I've had so many discussions in groups and in all of this stuff about the difference between a coach and a therapist. Okay. Now, I'm going to say my piece, and if anybody wants to add it, it's great. But I think that this is something that we need to know, right? Okay. When you think about, let me just start off as a therapist. Okay. I believe, and this is based upon my professional and personal experience, I believe that a therapist has the ability, the training, and the certification to be a therapist and a coach. A coach has the training and experience to be a coach. Okay. A coach cannot be a therapist, but a therapist can be a coach. Okay. The reason that is because, you know, therapy is all about addressing, right? The environmental factors, the psycho, the psychiatric factors, the social factors. It's the whole person. When you look at the coach is also addressing the person, but they should be addressing it based upon where they are now and where they're going next. Okay. Coaches can go backwards, but they don't have the training to guide you forward emotionally and clinically. Okay. A coach cannot diagnose, but a coach can set goals and help you through the journey of accomplishing them. A therapist can do both. They can diagnose, treat, and help you to accomplish your goals. There have been times in my practice where the goal was simply to deal with the emotions so we can get their business started, so we can get them to change relationships, so we can get them to go back to school, or change their mindset, help them to navigate through changing their mindset so that they can accomplish their dreams and goals. I can do that as a therapist, and I am a coach. Okay. Coaches do not have to be certified. It doesn't take away from their experience, their knowledge, and their level of expertise. It's just a matter of the different professions, right? And so that's kind of like in a nutshell what I think. Does anybody else have anything to add with that?
No, perfectly stated.
And I think it's important because some people say, do I need a coach and a therapist? If you want one, yes. Right? And because there are all kinds of coaches. There are football coaches, basketball coaches. Listen, there are financial coaches, whatever. If we have been able to accomplish something, and we have the ability to help people navigate accomplishing something, then we have the ability to be a coach. It ain't that, don't get caught on the word, but really just think about whether or not you believe this person has the capacity to take you from one point to the other. And I always talk about this because some people they understand, but other people don't. And so we are all needed. Coaches, therapists, we not in competition. We work together, and we work together very, very well. And I think it's a good thing because, sometimes experience is the best teacher.
Yeah.
And when you have found success in doing something and you have the desire to help someone do that, hey, you're doing God's work. And so I think it's so important. So Danielle said two different things to me. Absolutely. And Danielle, who is a business coach, she says a coach, and that's it. Absolutely. Absolutely. So tell us a little bit about you and how we can reach you. And I'm going to actually put it in the chat while you guys are talking. Your websites, if you could say it, and I'm gonna put it.
So I'm again Bridgette 3 from Starting Point Therapeutic Counseling. The easiest way to find me is on Psychology Today. I'm in the Owens Mills area, 21117. Or
is that Starting Point Therapeutic
Counseling.com.
.com?
Starting Point Therapy, yes. www.startingpointtherapy. Yes, ma'am.
Okay, go ahead.
Or the easiest way to reach me, find me, send me a message is if you go to Psychology Today and type in my name, Bridgette Threet, or put in the zip code 21117. I will pop up and you can send me a message.
Okay.
Yeah. And I do a couple of different things. So I am one portion of Keys of Hope Consultants LLC, and it's Keys of Hope Consultants .com. I'll also be launching another project that I'm doing around culture coaching. So I will stand in the what is that? The position of being a clinician who is turning kind of and doing some coaching, and so you can email me at at gmail.com. And I'll be launching my site pretty soon, but that's the best way to find me. And also on Instagram, I'm Tiara underscore Simone. And again, I post quite a bit around like just mental health tips for parents and for adults, for children, and for people who serve and work with children and communities.
So you said Tiara underscore Simone.
On Instagram.
Okay. There we go. And then I have Keys of Hope Consultant.
Consultants.com. And so again, I do have a business partner, Lauren Capel. We're both licensed social workers. But again, we work a lot with like churches and schools or anyone who will have us. We did some training for BGE. Um, they were looking to kind of change the culture of how they deal with trauma in their organization. And so again, we don't necessarily just train typical clinicians. We train anyone who's just willing to change the narrative in the spaces that they serve people. And so again, if you are of an organization who's interested in more trauma informed care practices or just wellness and self-care in general, definitely check out our website and yeah, let us know how we can serve you.
Excellent.
Do you have an IG account, Bridgette?
No,
Is there
ma'am.
Okay.
I'm not that. I haven't grown up there yet.
Okay. So do you have any any IG information or anything that you want to put on there, Kenya?
I don't. I'm with Vaughn Therapeutic Systems.
There you go, girl.
There you go.
All right. So okay. So and I did put that on there. So thank you guys. I really think that this is a discussion that is so needed, and we're having so many discussions, not only us as clinicians, but all over the world. This mental health is like this buzzword now. And I think that it's so important for us to understand the sensitivity to it. The other thing is, Tiara, you also are a parent educator. So you do a lot of training with parents for what?
So again, around just best practices around just like building connections,
Okay.
relationships, around generational trauma, is one of my biggest things that I like to work on. How do we break some of those habits that we were taught? And how do we be better as parents, and connecting with our children? So, yeah, around that too.
Good, good, good. Good. And so thank you, ladies, for this good stuff. I believe that so many people are helped. I think that, when we are getting into this subject, it's something that's never ending. People always have questions about it and just don't know. And so being able to have these very authentic discussions, letting people know what it is, especially when it comes to the money part that we talked about and the diagnosis part. So all of those things were key. Thank you, ladies. Do you have any final thoughts or anything you want to say?
Nope.
I just want to thank you. Truly, it was an honor to be here.
Yes.
And just want people to remember that if you have a mental illness, you have an illness. You're not the illness. So don't allow that illness to define you. And just as we've been saying, that we are a 3-part being. So take care of your mind, your body, and your spirit. It's just important.
And I would say the same. I want to thank Ebony. I just stop calling her Ms. Ebony. So she used to be my supervisor, and she's always my lifelong mentor many, many moons ago when I was a baby social worker. But I thank you for the platform. I thank you for just being obedient about having this discussion. And I again would probably echo the same. If you are going through whatever challenge, it doesn't make you who you are. It's just something that's a part of you, like anything else. And just know that there's help. Have discussions. Stop talking about it in your circles. Start talking about it in your families. And don't feel like, again, you have this big scarlet red letter on you just because something is happening. Let's talk about it. Get the help and support that you need. It's out there, and people are willing to help.
Yes, we are.
Awesome. And I have, in closing what you guys said, I put talk to someone. It's okay. You still strong.
Yes.
Right? Strength is in getting the help you need. Thank you, everybody. I love you guys, and I'm just so excited. I know that people are going to be helped, and that we all are living out our purpose, and that's the wonderful thing about healing.
Yeah,
we are all working as healers in God.
Absolutely.
Good night, everyone.
Good night. Thank you
Good
again.
night.
Good night.